This is a labiaplasty procedure, which is a surgical procedure which is performed to reduce the size of the labia minora, which are the internal parts of the female genitalia. So this procedure is suitable for women who are experiencing functional issues with their labia minora due to rubbing and chafing on clothing or sporting equipment such as cycling saddles, experiencing discomfort in the underwear and the clothing that they are desiring to wear, and also issues during sexual intercourse where the labia minora get in the way of sexual intercourse with a partner. I operate on women above the age of 18 years old. That is because the law of consent and female genital mutilation in this country requires me to do that, and also because the labia have not finished maturing and growing until one is 18 years old. Most commonly, I would say I perform it on ladies who have completed their family, so around 40 to 50 years old. In the younger age group, it tends to be patients who are either elite sports people or dancers who require to wear tight costumes, tight leotards for work. And then I also do on the older age range, so postmenopausal changes, women who have always desired to change their external genitalia for functional reasons, but have never really had the opportunity or have ever heard about the procedure. This is a surgical procedure. I use a technique which is called the trim technique, whereupon a scar is formed along the length of the labia minora to remove the excess tissue that is protruding beyond the labia majora, so that they sit flush with the labia majora and don't protrude further and cause the rubbing and chafing. One requires some labia minora for functional reasons. It provides lubrication to the vaginal introitus, and therefore it cannot be cut completely flush with the vaginal opening, as the labia minora are required as a functional thing as well. Most commonly now I'm doing it under local anaesthetic. Women do not want to go to sleep for this procedure, they want to stay awake, and it's very comfortably done under local. General can be done as well, but as I say, I used to say about 70% of ladies wanted it done under general and 30% under local, and now that's the complete opposite. I would say I do the majority of my labiaplasties under local now, and that's patient wishes more than anything else. To prepare for that, we do apply a numbing cream. So that is applied 30 minutes prior to the procedure, and that makes the injection of the local anaesthetic into the labia minora much more comfortable and in some cases almost imperceptible. We're very lucky to have an all-female team here, so hopefully the ladies that come for this procedure are very comfortable and feeling very confident about their choices and why they want the surgery. They get prepared in the pre-preparation room with the numbing cream. We check their consent to make sure they're happy to go ahead, and then they come on into theatre. In theatre, they're positioned in what's called lithotomy, so they have their feet in special little padded boots that are suspended on the table so that I can have access to the external genitalia. And then everything is prepped with sterile surgical solution and drapes, and then we go ahead with the local anaesthetic, and once everything is lovely and numb and has been checked, then the surgery starts. The procedure takes about 45 minutes to 1 hour to do a labiaplasty, depending on how much tissue needs to be removed. We ask our ladies to stay for approximately 1 hour following the procedure to have a cup of coffee or tea, to relax and to be checked to make sure that there's no early issues with any bleeding, and that they're comfortable to go home. Most issue, it tends to be with swelling and some discomfort of the external genitalia following surgery. Not usually more than simple painkillers would take away, but one does need to rest up and take it easy for the first 2 weeks after this surgery. Try and refrain from any long walks or cardio activity. And then after 2 weeks, things are feeling pretty much back to normal, in that normal activities can resume. And then at about 6 weeks, penetrative activities can resume, such as using tampons or intercourse. Approximately 6 weeks for sporting activities, particularly if you're doing spin classes, cycling, horse riding, that type of thing. Labiaplasty, the results are lifelong. Once the excess tissue has been removed, then it does not grow back or become more prominent again. So it will remain as it is once the surgery has been completed.